announcements by person. Okay, Ms. President. Okay, deal. So I want to welcome everybody to the SHAC meeting today, and we're going to do some announcements. Becky, will you announce your guest that's with you today?
Sure. So those who don't know me, I'm Becky's Scouts blog, but they will move. I'm Becky Scouts with First Look Pregnancy Center here in Waxahachie, and Trish is from Hope Pregnancy Center in Kansas, and she is their program for safe curriculum in that area. So she would like to know more about SHAC and how she can partner with SHAC. And I told her this is a great example of a good SHAC. So I invited her to come with us today and see how we function.
All right, welcome. And Melissa? Okay. All right, good deal. Yeah, would you like to introduce yourself?
I'm Ms. Foster. I'm the principal at Forsyth.
Oh, nice to meet you. Okay, so I did do a little something out of order. So we did need a review and get an approval for the meeting minutes from September the 30th. Do I have a motion to approve the minutes? Okay, Sandy? Do I have a second? Becky? Okay. Any opposed? Okay, all in favor? Okay, all right, so we'll move on. Let's see, on some of our updates, I'll go ahead and update a few things that we had at REACH. We did do the prescription drug take back at the end of October, and we collected 764 pounds for Ellis County, that's a pretty large number when you think about it. But that was an opportunity for people to be able to dispose of any expired or unused medication in an environmentally safe way to do that. Just in case you're not aware, there is a permanent drug disposal program at the Waxahachie Police Department, and then we actually have placed some takeaway envelope boxes at all the fire departments across Waxahachie. So you can actually go by and just request an envelope. You put your medications in it, seal it up, and send it off, and then they're safely disposed of through the Sharps Compliance Agency. Also, I kind of wanted to mention that we provided our school counselors for WISD with some stress kits, and I hope they're getting a lot of really good use out of those. We also, REACH Council has started this past year doing a monthly podcast, so you can go to our Facebook page. We have a lot of helpful tips that are going to be on there, things that maybe, we think that parents or family community need to be aware of. So I just request that you go in and check out our podcast. Also, we are doing a fundraiser. This year we had to put our Cupid Shuffle on hold because of COVID, but we are going to go ahead and try to do that again this year in February. It'll be February the 12th, starting at 8:30. It'll be at the Midlothian Multipurpose Center. And so it is a 5K, and we have two options. You can do an in-person or you can do a virtual. And so you can go into our website and get more information on that. And we do offer a discount to those that attend the SHAC meeting. So you'll just be sure to plug that in on there that you're with SHAC, and then we also offer a discount to any of our runners through WISD. So if there's any students, I don't know if there's any running clubs that might be interested in doing that, but they can do the Rowdy Runners, and they just don't get a t-shirt or anything like that. But everything's on the website, so I just recommend that you check it out. That's one of the ways that we generate some funds for our agency throughout the year that's not grant affiliated. And I think that's about all that I have for REACH at this time. And so I'm going to ask Santana if she will join me and give updates on Impact Waxahachie.
All right, good morning, everyone. So last time I know we discussed COVID funding for Impact Waxahachie. We do have that in, so we do have approval to use some of that funding. And so right now we're in the stage of kind of getting together and figuring out what we want to do. The funding is more so for, like we said, mental health and therapy type things. I know we discussed in our actual coalition doing like art classes or doing a fishing day at the park, or it could be yoga or dance, or we even decided like trying to do Build-A-Bear. So these are activities for families or adults and children. So we kind of want some ideas. If you know of some things that in the community you know would be helpful and beneficial, that could help healing and give, kind of people some encouragement during this time, definitely throw those all this way. I'll take all of them. And there's so many other things that we can do. So like budgeting, credit, banking, we want to be able to teach them a lot of things as well. So if you have any ideas of that or ways that we can work together at your organization or the organizations that would be great to partner with, please definitely let me know. That's our biggest thing. So we got tons of funding and we need to get that spent. It's nothing like spending money. It's not our own, so let's spend it. Because I don't want to spend all of my own money. Next, we do meet for the Impact Waxahachie. We meet on the second Wednesdays of the month. We have been meeting virtually, but I've kind of introduced the subject of us kind of meeting in person maybe after the new year. But if you can meet on the second Wednesdays at 10, get involved with us, help us, really push this out in the community, because this is for here. This is for the community. So whatever we can do to help in this community, let's be a part and push that out. I'm just the overseer, so I'll take all and any help that I can get. I do want to mention, I know we talked about the drug testing kits. We've talked about that a little bit. I did order those. I have those in stock at the office, so we can get together and see about dispersing those to you, Melissa. Okay, perfect. And then I also wanted to know, I know Lieutenant Oliver, you may know a little bit more about this, but if you can tell me kind of like some trends or things that you're seeing like in the schools. I was going to kind of ask the Pastoral Alliance as well, because we're redoing our logic model and just kind of need to see what's happening, what do we really need to be focusing on in order to address what's really happening in the community. So any input, throw it this way. Other than that, that's all I have.
All right, thank you, Santana.
You're welcome. Go ahead.
Is this funding the grant, is it a one-time grant, or how does that work?
It's a one-time grant, as we know right now, and it's over 18 months.
18 months.
And so we have so much we can spend, I think, in the first like 12 months, and then we have like the rest. But everything that we're doing had to be approved. So like some things that it was so vague, and so we had to submit in a lot of things. But we submitted in for a lot of the therapy type things, and so that we do have approval for those.
Yeah, most of that funding is to try to get more members of the community out. Everybody was kind of afraid to go and do anything, and so that's basically the purpose behind it. And as Santana mentioned, the mental health of our community has suffered a lot through this process, and so anything that we can do to help bring families out, give them some relief and things like that is what it's being used for.
Or parents' relief,
Yeah.
Kids, it may be a time they can just bring their children and take that time to, relax. So, thank you.
Thank you, Santana.
All right, and let's see, our next update is going to be on the WISD security update by Lieutenant Josh Oliver.
I get to come sit front and center, huh?
Yeah, don't let me sit up here by myself.
So before I came to the meeting, I was kind of going through some stats and things for as far as what SROs have been involved with since the beginning of the school year. And it seemed like in September, when all the kids came back from summer break, we were hit hard and heavy with a lot of like vape pen type things. And I know we had talked about that in previous meetings. Those have dropped down pretty significantly. In fact, we implemented a new, this year we started using a new drug dog service called H1K9. And so we had been using InterQuest before. We kind of changed directions and went forward with H1K9. And here lately, the number of students that we've searched has picked up dramatically in the classrooms. We've also implemented metal detectors. So while we check the classrooms, we also run all the students through metal detectors. And what we're finding is that we're finding far fewer vape pens and stuff than what we were at the beginning of the year. So it's starting to trend down, which is really good. What we are seeing, especially this time of year, is more of an uptick in we title them emotionally disturbed persons, but it's going to be your mental health type calls that we see amongst the kids. This time of year, it's hard. I know I was talking with Mark White before this, is we look at this as a great, joyful time for a lot of our students that look forward to the holidays, but we also keep in mind that it's also a difficult time for a lot of our students because of things going on at home and things like that. So we have seen over November, the end of October with the Thanksgiving breaks coming up, we saw an uptick in runaways compared to what we had seen, and then kind of kids acting out emotionally is something that we're seeing a lot of right now. So our switch has been from, even though we're seeing a decrease in the amount of substances and things that we're finding in the school, we are starting to see an uptick this time of year in kind of the mental health side of things.
Okay. I was going to just share, there's some, we list on our website because it's something that we actually hear a lot is, especially during the holidays, it's, as you said, not always an easy time for some people, but we do, share on our websites and through our Facebook, the National Suicide Prevention Lifeline, there's veterans programs, any disaster relief. There's also the national helpline that's put out through SAMHSA, behavioral health treatment services. So there's a lot of different things that are available. And so, if you have any questions or need any of those resource numbers, please feel free to reach out. And if there's anything that we can do to assist, please let us know. It is, as I said, it is a tough time for some people. All right. Anything else?
No, ma'am.
All right. Well, thank you very much. Okay. So now we have our WISD health update, specifically including WISD's response to COVID-19 and the status of the current conditions by Melissa.
Hello. Thank you for being here. We don't say that enough, but we deeply appreciate your willingness to serve on this committee. It's really important. The stuff that flows through SHAC is important, and we appreciate you being here. Also, I'm taking advantage. I also want to thank Lisa Radel-Huber. She is the one, any organization or anything that looks good, it's all her, okay? I just want to say that. So she is greatly appreciated as well. Yeah, we have our crew here that set up tables as well today. All right, well, I'll start with drug testing today. We have had 2 sessions so far this year of drug testing. We usually get started in October. There's a little bit of a turnaround time at the beginning of the year, getting all the students that are supposed to be in the pool into the pool. So we usually don't start testing until October. So we've had 2 sessions so far this year. Out of those sessions, we had, the first one we had 3 marijuana positives. And then the second session, we've had 2. The great news is all 3 of the positives from the first session tested negative the second session. Those students will be tested every month for the remaining sessions of this school year. So for them to test positive and immediately turn it around and test negative, that's what our program is for. okay? We're not trying to get kids in trouble. We want them to make a different choice, and clearly they did. So that is good news. That's exciting. So, yes, ma'am?
How many kids are tested
At each school. We do about 60 or so kids at the high school. We do 10 kids at Global, and then 10 kids at both Howard and Findlay, and 12 kids at Coleman. So that's currently our numbers. That's what the board has provided for right now. So if ever, we want to look at that again and make changes, please let me know, and we will certainly talk about that. But that's what we're doing right now. So, any questions about drug testing? Yes, Mark.
Marijuana positives for those all at the high school?
We had 2 at Waxahachie High School, the first session, and 1 at Global. That was really the first ever positive we've had at Global in 5 years. So, that's pretty good. Then the 2 positives we had this last session were both from Waxahachie High School. So, yes, ma'am.
Melissa, do the students know how many people are going to be tested?
That's a really good question, Christy.
In a campus,
Uh-huh.
kids want to do 10, what the odds? I just wondered.
Well, yeah, they all know they could be. Definitely, they know they could be. And that's the idea of the program, is to be a deterrent. I might get tested, so I better be careful. They can look around, I guess, when they're being tested and figure it out. But as far as have we sent that information out, no, we haven't.
Do you know why those boards came up with those? How did they come up with those numbers?
Well, at the time, Lee, help me here. You were in that part of it. I wasn't.
I mean, ultimately, you're just trying to reach a proportional amount. So we did a contract for 100 tests a month, and that's roughly the breakdown. So it's about 100 tests a month. As a parent of multiple secondary students, I would say that mine were very well aware of it and were tested. And plenty of other folks I know have kids that have been tested at one time or another. So it's reached a pretty broad cross-section. I know that all of the kids know they could be in the panel that month or future months.
And just as a reminder, they are excluded from their activity, whatever activity put them in the drug testing pool. They're excluded from that activity for 10 days at least for a positive. So I feel like I should let you guys know this as well. Just like every place else in our country right now, the drug testing labs are running at a shortage of staff. Whereas our turnaround time was about a week in previous years, it's more like 2 to 3 weeks. So it's a lot slower turnaround time. So I don't like that, because obviously kids that test positive, it's like it was a month ago sometimes, and that's not the most ideal situation. I know they're doing the best they can to get the results as quickly as they can, but that is happening, so just so you're aware. Okay?
I actually have a question on that, too.
Okay.
Did the kids, do they talk to you about, on the marijuana, is it something they're smoking, vaping, or is it through, edibles, or, because the concern I have is, the Delta 8, which we've talked about before. I mean, it comes in so many varieties, and I've seen things on social media where we have a lot of places in Waxahachie that actually sell the Delta 8. And it's considered legal, but a lot of the kids don't realize even by doing that they could easily test positive for the THC. So I was just curious if it was something they were thinking that was legal, that they were safe to use, and if it's something that we need to educate a little bit more on, as far as letting kids know it's just like CBDs and things like that you could still in a drug test positive for THC. So I was just curious if there was any indication on what they did.
Most of the time, it seems like it's vaping right now. I've never had a student say, I'm so surprised. I didn't know that that would make me test positive. I've never had a kid say that. So I don't think that's happening. I can certainly be more purposeful in asking that question in our parenting sessions. It probably would be a good idea just to make sure they understand. But I have not had a student tell me that at this point. But
As far as the panel goes, we originally had 5 drugs on the panel. After that first year, we never had more than 1 or 2 kids a month. And as Melissa was just giving you the numbers, we've had over the course of the 4 years we've done this, only 1 now at Global, and only 1 at 2, I think, of the junior highs. Everything else has been high school, and it's never been more than 3, I don't believe, in a testing session. We will pretty regularly, about once a testing period, get a kid with amphetamines, and I believe each and every time we have found it's not meth, but it's
That's correct.
A prescription medication for ADD or ADHD. So those get cleared once we talk to the
Yeah.
parents, and they don't get listed as among our positives. We went to a 10-drug panel after that first year, just thinking, well, let's just make doubly sure.
yeah, we thought
I
we were
don't-
missing things.
I don't believe we've hit on any of the additional drugs. It is marijuana or THC. That is the drug of choice, and we have felt reasonably assured that while it exists, it's not rampant. Generally speaking, out of 100 kids, out of 60 or so kids at the high school, you'll get 1 or 2, and none at the other schools typically.
And we're not unaware that our testing pool, maybe the kids that are most at risk may not be in our testing pool because they're not necessarily involved in anything. We do get a lot of kids that are student drivers, so they may not be involved in any activity, but they are student drivers, so they are placed into the pool. So we get a few more kids that way. I would love to be able to reach all of our groups. Hopefully that's something we can look at one day. But under the current law and the current policy, this is what we're doing. So any other questions? Okay, great. And now we'll go to COVID right quick. It's been a roller coaster year a little bit. We started out with a bang on COVID numbers. At one point, we hit 300 plus. Our lowest day so far this year was last Monday. It was 3. So that is such a praise. And today it's at 11, but right now things are going very, very well. We don't know what the holidays will bring. We all hang out together over the holidays, so that may make our numbers bump up a little bit. We'll see. But right now things are going very well. Currently, we do not have a mask mandate. We don't really social distance unless it's super easy to do. Lots of good hand washing, hygiene. Any questions about COVID? I'm hoping this is a subject we can take off our list one day.
If you saw news from the federal government about Head Start and the requirement that all Head Start employees, volunteers, and children aged 2 and up be masked immediately, and that all Head Start employees be vaccinated by the end of January, we don't have any federal Head Start programs within WISD. Our daycare center, our pre-K, none of those receive federal Head Start funding. So that mandate is not applicable to us. Now, some of you, I appreciate all the good folks in here that have countywide reach and regional reach. There may be some schools that are impacted by that mandate and now doing things for their Head Start program that they aren't doing at other campuses because in Texas, the Fifth Circuit recently affirmed essentially Governor Abbott's ban against mask mandates and essentially prohibiting schools from having a mask mandate. The federal government is supreme to the state government, and the federal government, the Head Start program has explicitly said where you're in a state where the state has taken action to the contrary, our rule supersedes state rule. So, like I said, if you're in one of you that has a regional outreach, you may see some Head Start employees, volunteers, and kids masked, but that's not applicable here. Not yet, hopefully not ever.
One last little nursing thing I wanted to bring up. One of the big reasons that Tina can even be here today is because we now have a float nurse over the last 2 years, I guess, in Waxahachie. This is the third year, and that is really due to Mr. Alvenshine, and I just appreciate that so much because we have somebody that can cover for Tina and make sure her kids are okay while she's here serving on this committee. And that float nurse has been just great. I mean, having her during this COVID time, I don't know what we would have done if we didn't have her. We've had probably about half of our nurses have had COVID. So that's a lot to be out for an extended period of time. So I just wanted you to know how thankful I am for that position and that the district has provided that. So any other questions? All right, great.
And I was just going to mention something that I failed to mention on my notes. Any of our high school counselors that may be in attendance today, I just wanted to touch base with you on the buzz-free promises that we're actually working on with Recovery Resource Council out of Dallas. We are partnering with them to do what we called our pop-up prom events, where we provide free prom attire, primarily dresses, but there are some suits that we have for the young men as well. We are looking to try to pull this off in February in Ellis County. We're looking for a centralized location that would be easily accessible to all of our school districts in the county. But I did want to reach out to you and let you know that I will be making contact. We're still working on the only requirement that we're being required to do this year versus last year is that we do have to do a 30-minute presentation, and we are going to be set up. We're looking at doing like a Thursday, Friday evening, and then a Saturday day event where students could come any of the 3 days. They can participate in the 30-minute presentation, and then they get to go shopping, for their prom attire. And again, these are primarily all new dresses that's been donated through whatchamacallit. And some of them have a pretty hefty price tags that are still on their beautiful gowns. We had, I think, brought in over 300 gowns this last year. Last year we did the pop-up at Global was the location that was chosen last year for WISD. And we left the dresses there. The counselors were awesome about helping work that event. And students were able to take home and keep their dresses. And so we are working on that again. We are actually looking for donations of some of our larger size dresses is something that we're having difficulty. We don't have a good number of those. And we don't want anyone that comes to the event to leave without being able to get something. And so that is something. So if anybody knows of any places that might have or be willing to donate either new or gently used gowns, we would love to talk to you about that. But that is coming up in February. We don't have the date or the location tied down just yet, but I did want to let you know that is going to be available. I know I talked to some of the counselors about, if you would prefer that we provide video and you do it at your campus. The kids get to do, basically it's a Google document to where they do like a pre and post test, and then their name and their number goes into the pool. That way they can just show up, we'll check them off, and they can immediately go shop. But if they're not on the list, they do have to go through the 30-minute presentation. But that is something that's going to be coming up pretty soon. So it is our Buzz-Free Promises, where we talk to the kids about celebrating responsibly and not to choose, alcohol or drugs when they celebrate. So I just wanted to kind of touch on that because that is an important thing that's going to be coming up as we're getting into prom season after the new year. The next thing that we've got going on our SHAC presentations, we have the American Heart Association Employee Wellness Program with Kelly Story.
I'm not Kelly Story. Kelly had a doctor's appointment today, so she had a conflict that she could not be here. But she is going to try really hard to be here for our January meeting. Just to let you know, we are participating in this wellness program for our employees where we are trying to get them to be more conscientious about watching their blood pressure, their diet. They can make a contribution to American Heart Association and get a T-shirt. You know, a T-shirt's always involved. And if they do that, then in the month of February, they can wear jeans on Thursdays, I believe is the day. So I don't want to steal Kelly's thunder. She will share all this with you when she comes, but that's why she's not here today.
Bring on T-shirts and jeans on Thursdays.
Yes. Just say the word jeans to educators, and they just get so excited. Okay.
And we've got the next one.
Yes, we do.
Okay, so we have Ellis County Early Childhood. We've got Cindy Sewell that'll be coming and presenting.
Thank you for having me. I'm Cindy Sewell. I am an independent consultant that has been contracted through MHMR of Tarrant County to assist Help Me Grow North Texas. I actually helped in the origination of the centralized access point, and they are now have contracted me to build an Ellis County Early Childhood Coalition. And so in order for Help Me Grow North Texas, who is serving 18 counties, to be successful, we need an Ellis County Early Childhood Coalition. So we have begun forming that coalition. We started in May. And so I want to tell you a little bit about Help Me Grow so you can kind of understand where you guys can utilize Help Me Grow as well and how that correlates to the Ellis County Early Childhood Coalition. So, okay. Okay. There we go. And I'll turn a page. I'll turn a page. How about that? Because I realized I'm glad I printed this since it's behind me.
It'll help you.
No, that's okay. That's okay. You can click it. I mean, I can click if you want me to.
No, that's okay. I got it.
Okay. All right. Well, Help Me Grow North Texas is a community-wide support network for supporting families from pregnancy up to age 6, and it encompasses several different areas. It actually is covering an 18 counties across North Texas, and it is a national evidence-based program. So the goals for this presentation are to share how Help Me Grow can be a resource for families and providers, as well as explain how families can become connected with Help Me Grow. So as I mentioned, it is a national program. Dr. Paul Dworkin was an MD, and he is the founder of the Help Me Grow National Center. So his quote is, what if our goal for child health services is not merely to treat or even prevent childhood diseases and disorders, but is also to promote children's optimum healthy development? So, and I'm not going to read through these shared assumptions. You guys are pretty familiar with all of these things. A gap definitely exists between child health and child development, and so we are trying to bring everybody together, all the sectors together, to have a coordinated region-wide system, okay? We want to catch children very young that have disabilities or have issues, so that by the time they reach the elementary schools, they will have already begun services. Brain science, we can just skip over this one. You guys know about brain development and all of that, so we'll skip over that one. We'll look at the trajectory of of healthy development, and you guys, know this as well, that, when trauma and different negative things take place, then it's, a very different trajectory than if we have a healthy environment for children. We do have developmental promotion for Help Me Grow. We have referrals and follow-up. So we do screenings and monitoring as well as ongoing activities. The 4 different areas of Help Me Grow is we have a centralized access point, which is a specialized child development line, and currently we have 11 navigators that answer those phone lines, and I think actually that is expanding to 13. These are child development specialists that are trained in areas of child development. They're also trained in motivational interviewing. They're trained in trauma-based care and things so that they can speak to families. We also have mental health professionals that can be brought onto the lines to help families immediately, and we have that available as well. So these navigators are actually trained individuals that are answering phone calls. It is a centralized access point for all of North Texas, so all 18 counties can be served. We don't just pass out phone numbers and things. We try to actually link the families to different programs and get them, and we provide follow-up services as well. So they are not just turning a family loose and not ever following up with them. They have a follow-up, a schedule of 2 weeks, 6 weeks, and 10 weeks, I believe. Don't quote me on that one. But anyway, they do have a follow-up system put in place to follow up with the parents. We also have a resource directory that is actually online. It's called Find Connect. Actually, if you go to the Help Me Grow website, you can gain a link from there. It's actually hmgntx.findconnect.org, which has a wealth of resources on it, and we are updating those resources all the time, and so it is very up to date. We encourage, families as well as professionals to utilize this resource database, and it is something that we, like I say, that we're updating constantly, and they are trying to keep all that information up to date. Then there's also a family and community outreach piece, so they're engaging community partners, networking, doing community events and trainings, as well as marketing. Then we have provider support and training, so we're providing a lot of professional development, training on developmental milestones, as well as surveillance and screenings, on referrals and linkage, and closing the feedback loop as well. We also have a data collection and analysis, so we're collecting data across these 18 counties, and it's actually, we have a pretty extensive database that they use that we're actually getting some good data out of, that we can actually show where services are being provided, where we're getting calls from, where services are being provided, and where we have gaps in those services. It's actually a mapping system that can actually show all of those things. So we can see if families are calling for a particular service and there's nothing in that area to serve them. And so we are doing that data monitoring as well. Okay, all right. The service area, you can see the 18 counties that are listed. We had started with 12 counties. Well, we actually started in Tarrant County, and then we began growing after that. So you can see fall of 2021, we are now encompassing all 18 counties. The Help Me Grow has been adopted by the state of Texas as well, and there are 6 regions currently that are in the state of Texas for Help Me Grow that have Help Me Grow programs in them. Tarrant County was the first one or Help Me Grow North Texas was the first one to initiate this. And so some of the other counties, some of the other regions are kind of looking at our program and trying to kind of mimic that throughout. We actually we got started on our centralized access point. We kind of were accelerated with that because of COVID. We were supposed to, and I was heavily involved in that at that point, and we got going up about 6 weeks early because of the COVID pandemic. And so we quickly realized that we needed to not just be a service provider or resource provider for we're not a service provider, excuse me. We only provide resources to families and things. We don't provide direct services. Help Me Grow does not. But we realized right away that people needed, they needed food, they needed rental assistance, they needed all of those things, as well. And so we quickly grew our resource database to include services serving the entire family, not just early childhood. And so that's the way we're continuing that. As we all know, you can't have healthy children without healthy families. And so that's, that's definitely a piece of that as well. So it is a nationwide program, and then you can see the states that have adopted the Help Me Grow evidence-based program throughout the nation as well. So the Help Me Grow call center, as you can see, we've kind of basically, I've kind of already gone through that. They connect families to resources and supports. They answer questions, so they can answer child development questions parents may have. And we can also do developmental screenings. They use the ASQ screening tool to do developmental screenings. We either encourage parents to go online and take it, or they will walk parents through the screenings as well. And so they are helping getting kiddos screened as well. And how you refer to Help Me Grow. So there are actually a couple of different ways. We do have a referral form that you can fill out. You can also, you can call the Help Me Grow phone line. You can email a referral form to the email listed here, as well as fax. You can also go to the Help Me Grow North Texas website, and you can click on the Connect with a Navigator, and that will send the information directly to a navigator. So families can go on and refer themselves, as well as any other professionals can go on to make a referral as well. We encourage professionals to call if any of you or anyone you work with needs resources. Professionals can call up and get resources as well, and they will help professionals as well. So we encourage you to connect with Help Me Grow North Texas through our website, through our resource database as well. We ask if anybody's interested in joining a subcommittee. We welcome that. We also have a partner pledge that people can fill out if they want to partner with Help Me Grow North Texas. We haven't introduced that in our Ellis County Early Childhood Coalition yet, but we will be doing that as well. You can order some materials. I actually brought a packet of materials for each of the 15 schools that if each school will take a packet, it's got some information in it about Help Me Grow and some different developmental things in there. So you can also order those materials for staff and families as well if there's something in there that you want to order. And you can also request trainings for those of you that would be interested in that. The Ellis County Early Childhood Coalition, as you can kind of see with some of the goals and things of Help Me Grow North Texas, that is why we needed an early childhood coalition in Ellis County. There wasn't one. We actually are looking and involving ourselves in coalitions throughout the 18 counties. Ellis County didn't have an early childhood coalition, and so that's why we decided that we needed to help get that going. We are meeting the third Wednesday of each month from 11:30 to 1. We are meeting virtually. We're trying to meet, we actually have our first in-person meeting in January. We're trying to meet in person quarterly. And other than that, we are going to do virtual meetings. We're also going to try to have, even though it's in person, we're going to try to have a virtual option also. And so unless things change, January will be our first in-person meeting. So if anybody would like to join us, we would love to have you. If you have anybody that you know of that should join us, please pass along my information. And on one of the next slides, my information is there. So thank you very much for having me. And I will accept questions. If you guys have any questions, my information is actually, there's questions. Oh, okay. Then one more. Yeah, there you go. Okay. There's my information. Somewhere on there was my information. So any questions? Any questions about Help Me Grow North Texas or about the Ellis County Early Childhood Coalition?
This isn't really a question, it's kind of a FYI, I don't know if you're aware, but our local hospital here in Waxahachie in January will be opening a neonatal ICU, which is really exciting. They're going to be able to take care of kiddos from 32 weeks gestation on. So now we're going to have a local place for our premature babies to go. They don't have to go all the way to Dallas. It'll help our families so much more, and I would think that would be a great place to get your information out. So
absolutely,
we're growing, and these kiddos that are needing these services are going to eventually come to us. So they need as much support as they can get.
Right. Yes.
Do you partner with pregnancy centers?
We do. Absolutely. Okay. That'd be great. Yes.
If you are here from a campus, would you please take this packet back to your campus and get it to your counselor? If you're a counselor, you can just take it. And I would greatly appreciate that. That would help me get all that information out there.
And I was just going to show, so we have these that are just a small, they are English, Spanish, little flyers, little rack cards, that if anybody's interested in these. We also have a large flyer that's in each of these packets. So that's just some of the information and some of the things that, that we have available. We also have some growth charts and some coloring books and things like that for young kiddos, if you guys are interested. So I'm leaving those there. So any other questions? Anything else that I can answer? We would love to have you join the Ellis County Early Childhood Coalition. We are real excited. We've had a lot of positive support and feedback in that. And we've got a really great group. We're starting to have some work group sessions. We've got a leadership work group and we've got a marketing work group. We're actually developing a logo right now. And got some really excited things going. We're still looking for folks to serve on committees and things. So we would love to have an ISD representative as well as others. So we would love to have you guys.
The third Wednesday at what time?
The third Wednesday from 11:30 to 1. Mm-hmm. Yes.
So you're going to do your in-person meetings starting in January?
January.
Quarterly?
Quarterly. We're going to do quarterly for now.
Okay.
Because of the county being so big, we're kind of thinking that, virtually may be a good thing to cover, all of the rural areas, because we're trying to get participation throughout all the rural areas, all the sectors. And so, a lot of times that's easier done, virtually. Now that we've learned all how to do virtual, or sometimes. So anyway, any more questions? Okay, well, thank you so much for having me. I appreciate it. Thank you all very much.
All right, thank you so much, Cindy. Okay, next we're going to have the 2021-22 SHAC subcommittees. The first one is Coordinated School Health Program Review with Dustin Binnicker, the chairperson.
don't have a lot of updates on this. We've essentially formed a subcommittee working with campuses to identify an elementary and a secondary point of contact for physical education classes. So moving ahead with the CATCH program that we talked about at our last meeting, and then working with child nutrition. So we'll roll into this in the spring so we can train our teachers up over the summer and start fully implementing this in the fall. Our time with teachers right now is finite, and the time that they do have, so we're trying to utilize it correctly and appropriately so we can form the committee and have buy-in from the ground level. So working with teachers and staff, working with counseling and child nutrition, so that next year when we roll into this with full implementation, we're reviewing some of the things. I think some of the campuses have been doing this for a long time. Some of the things are a little bit outdated that we've been doing, especially child nutrition. I think the old slow go whoa food is not what the current food standards are. So we'll work with child nutrition and make sure that we've got the updated information to share with all the campuses and post those things in the cafeterias and across those campuses. So that's where we're at for right now.
Anybody have questions for Dustin?
I do.
Okay, thank you.
Are you planning on training all of the teachers at each campus, or?
Well, so working with the two representatives for physical education, we'll work with them to train and teach the elementary personnel and then secondary as well, and then roll that out with counseling. So coordinate both between physical ed, counseling, and then child nutrition. So, all right. Okay, thank you.
Okay, next up we have the SHAC update on parental communication strategy with Sandy King.
Good afternoon, everyone. So at the last meeting, I think it was a parent, if I remember right, spoke up and said, how are we going to make sure we communicate all the great things that are going on with this committee? And all eyes turned to me because I was the only one at that meeting that was from the communications team. So thankfully I have Jenny here with me today too. In public relations at WISD, we have a 5-person team and we manage multiple channels of communication through WISD. So not only is it the old-fashioned way of print materials going out to every kiddo on the campus. But obviously we have our website, multiple social media channels with Facebook and Twitter and Instagram, and even some departments that have LinkedIn and work that very well. We have a radio show on KBEC, if you didn't know. And we also have obviously connections in the newspaper. We run an email campaign, so that's a weekly or bi-weekly newsletter, it's weekly newsletter, both to the community, and then we have an internal staff newsletter. And then, of course, in my position, going out with the community outreach to community events and things like that. I would have loved to come to this meeting today and give you this great, beautiful flow chart as to how the communications go, but everything is different, and every piece of communication that is disseminated differently because the platforms require that. It's a different audience on each platform. The urgency of the information is different. So if there's something urgent that has to go out, obviously we'll hit all channels. So anything that is going on that's pertinent and needs to be communicated out from WISD, get it into my department. Jenny will then tell which one of us to go where with it, and we'll base it on the actual piece of information that it is and what audience it needs to get to. So that's kind of how it works. But I'm just here to say we will do our part. And I can assure you of that. Does anybody have any questions about how it all goes out? Or how we make those decisions?
When do you do your radio show?
The radio show is bi-weekly also on KBEC.
Every other Friday, every first, third, or fifth Friday on KBEC at 12:30.
12:30?
Called WISD Chat.
I haven't looked on the WISD website in a while. How easy is it to find the SHAC information on the website? Because I know a lot of times.
Good question. Yes, and a lot of it is on the counselor's website as well.
I don't know, maybe on the counselor's too,
Yeah.
but it's.
I know it's in under the health department. All the SHAC minutes and agendas and all that are posted on that, on the health department page. So that's one way. Probably that is not the most,
3 clicks.
Yeah, I was going to say it's easy to me, but I'm familiar with the website. You just go
Yeah.
to departments.
It's 3 clicks. You go to WISD.org. You're going to click on departments at the top, and then you will click on health services. And then when you get to health services, it's on the left-hand menu. You
Yeah.
and it's all right there.
And I know the website oftentimes seems overwhelming. The city's website seems overwhelming to people that aren't used to going into it. But in my opinion, the WISD website is channeled very well when it comes to finding information because of that departments page, and you can really narrow it down.
We also have a great search function, so you can just go to the little magnifying glass at the top.
Yeah.
Of page and search SHAC, and it comes right up.
Yeah.
So there are
Yeah.
multiple ways you can.
Yeah, yeah. And like I said, very few pieces of information are only on one channel. Most of them can be found on multiple channels, if not all.
I think the main thing would be is even knowing what SHAC
Is,
is.
yeah, yeah.
I think it spells
It's,
it out
uh,
on the webpage.
it's on the web, yeah.
It
It's
spells
a-
out that
It
it's
says
a
School
student
Health
health
Advisory Council.
or school health.
Mm-hmm.
Yeah.
It does. I was really grateful that Shannon Bedingfield asked that question because I hadn't thought about it before as far as sharing SHAC-specific information outside of the district, even though, of course, we've got parents serving on this committee, but that doesn't mean that everybody gets the information. So we're going to be more intentional about sharing things that flow directly out of SHAC. So I was thankful she asked that question.
Yeah.
That was a good one.
And she wasn't the only one. That came out a lot when we were going through the whole visioning process with the community the last month or two on the surveys and the interviews and all of that. Communication came out often. So we'll make sure to be intentional about all the programs, especially SHAC. Yeah. Anything else? Okay, good. I'm off the hook.
Okay, well, that's actually all that we have on the agenda currently. I just want to remind everybody about the meetings starting after the first of the year. We have January the 13th, February the 17th, April 14th, and May 5th if needed, so you might put those on your save-the-date calendars. And if I can get a motion to adjourn our meeting today.
So moved.
Oh, okay, so we got Lee and Santana, so, okay, any opposed? I assume not. So we're all in favor, and thank you so very much for joining us today and being a part of the SHAC committee.